Hi, it's Dr. J. Faber. Today I have the privilege to have Dr. Keith Kantor with me. Dr. Kantor owns a company called N.A.M.E.D. It is a very innovative program to help those especially suffering from opiate addiction. Given that about 75 to 85% of our prison population has some type of substance abuse problem, I thought it'd be great to have Dr. Kantor come on and talk a little bit about diet, nutrition, and addiction. So, Dr. Kantor, why don't you tell us a little about yourself?
Well, I have a PhD in nutritional science and a doctorate in naturopathic medicine. But my area of emphasis is twofold, basically. One is to help people going through either the clinics, the intensive outpatient clinics, or therapists that have substance abuse problems, including alcohol, to help people that have problems with mental illness for the various diseases, the main diseases, and also to get rid of the inflammation that we almost all have in our body, but especially people that are addicted to drugs have in their body, because that plays havoc with a lot of diseases like arthritis, fibromyalgia, Crohn's, but also with the insulin mechanism, which affects the sugar. But basically what N.A.M.E.D does is we make sure through all natural menus that we don't stimulate the opiate receptors. And the opiate receptors are clusters of cells we all have in our bodies, and when they are stimulated, they release chemicals that give us urges. If we have any addictions or an inclination towards addiction to drugs, whether they be prescription or alcohol, whatever, our body tells us to have more of them. So the problem that we have even in the inpatient clinics, and why there's such a high relapse rate of 85%, is that even though they didn't take drugs or alcohol for that period of time, they just transferred the addiction, and instead of dopamine going up and down, they have sugar going up and down, or some other thing with the same mechanism. So you have to watch out for things like sugar, gluten, dairy products, artificial sweeteners, artificial ingredients like preservatives and additives, caffeine, nicotine. So all of those things stimulate the opiate receptors. So thinking of the prison population, where 75 to 85% of the people are at least involved in drugs in somehow, some way, I don't know if they're addicted, but they're involved in it. If we could not only change their mind through all the great ways that Dr. Faber does it, but if we could also change their diets, it's no more expensive. We don't stimulate the opiate receptors. It would give them less urges. We would stop the inflammation, which would also give them less urges. And between the two, escape and what we call N.A.M.E.D, where I'm the CEO, by the way, I'm not the owner, unfortunately. But I think it'd have a double effect on it. And then when the people get out, they wouldn't have had drugs, hopefully, for a period of time. The changes would be made in their brain, but their opiate receptors wouldn't have been stimulated for a certain period of time, so they won't go out and do the same thing and have I think it's a 60% recidivism rate?
Yeah.
If we could get it down to even 50 or 40%, we're heroes. And that's the concept of combining the programs is together. And we've seen those results just with N.A.M.E.D, going through the regular addiction clinics, the intensive outpatient clinics, and even the therapists, and we've seen excellent results for mental illness with that, where they've been able to lower the medicine. And I think we know, and Dr. J would probably know the real numbers, a fairly large percentage of the population in prison do have some forms of mental illness, I would think.
Yeah, oh yes, there's definitely a larger preponderance of mental
large.
illness, absolutely. So this is a real interesting concept. So you're talking about changing diet and decreasing acidity, and that leads to decreased urges.
Because you're not stimulating the opiate receptors. So if you don't stimulate the opiate receptors, you stop the urges. And if you stop the urges, then, okay, I don't want drugs. Maybe I want to work out instead. Maybe I want to clear up my skin. Maybe my goal this day is to go from walking a mile to a mile and a quarter, and give them different things to form self-esteem instead of drugs. We don't want them going back to prison or going back to a clinic, in the case of my normal work. and it works. We have to give them something else to think about. We have to make them feel better. And if we can make them feel better, if I could do it with the body and you could do it with the mind, and we could combine it, they don't want to go back to the place where they didn't feel good. I mean, it's just...
Right. So I'd be really curious, so from your experience and some of these other clinics that I've worked with you, kind of give from I guess a physician perspective, what kinds of things they kind of expect by putting their patients on this kind of diet?
First of all, depending on the type of clinic, in the regular inpatient clinics where they're staying there, they don't even know it's a different type of diet. Because we just changed it. They don't know the food's cooked for them. So that's good. In the intensive outpatient where they cook themselves, but they're very highly motivated, these are executives, doctors that can't take the 3 months off to go to an inpatient clinic, but can move their schedule around so they have 10 hours a week to see a therapist. The only question they asked me is the food yucky. That's how they put it. And I said, no, it's regular food. You wouldn't notice it unless you told it. No, you still have fruit. You just have more darker fruit because there's less sugar in it. You still have meat, chicken, potatoes. You just don't have a lot of the simple sugars. We stay away from dairy except for the yogurts. We stay away from gluten, but we give you gluten substitute products that don't have sugar in it. So it's a very easy diet to follow. It's actually no more expensive. I shopped it, or I had it shopped in like Publix and Walmart and stuff. And the difference in buying the foods for the family was within 1% either way. We did it 3 times. We did it for 30 days, 60 days, and 90 days, and it was never more than 1%. And at least half the time it was actually less expensive. And then we give them alkaline water, and you can just make the alkaline water with a lemon or a lime, put it in a pitcher the night before, and let it soak, and then that's the water that you drink the next day. Or you could buy alkaline water, or have get something called an ionizer which sets it. But now you're talking about spending some money, even though in the long run it's good. And right now both of us are researching a new water that happens to be alkaline, but it gets rid of the acid instead of just overwhelming it with OH, and so far those results have been good. But either way, we're going to get the body out of acidosis, which is causing inflammation, and keep the pH at that 7.35 approximate level, which will make the people feel better. Less aches and pains makes you feel better. Even if you have cancer, any doctor will tell you right away to go on an alkaline diet. So both the menus are alkaline, plus we recommend the alkaline water. And between that and escape, changing the brain, now we basically change the body and the brain, and that should definitely have I think, a pretty drastic effect on the recidivism rate in the prison.
So we work on some with escape ways to think differently, behave differently, and then we complement it with a dietary regimen that actually gets your body in a less oxidized acidic state.
That's correct.
And you get better outcomes.
And we don't stimulate the opiate receptors, which are telling us, let's have this, let's have this. Because when these people go back to their original environment, they're going back to friends that are taking drugs. If they don't feel like taking drugs, it's a lot easier. I'm going to stay clean for a while. But the only way to do that is by not stimulating the opiate receptors. Otherwise, they'll just switch. If you've ever gone to an AA meeting or an NA meeting, you'll see, like, I don't know the real percentage, but it looks like 90% of the people smoke. Because they get that same up and down feeling that they get from dopamine, from nicotine, or from caffeine,
exactly,
or from especially sugar. That's why somebody came out with a book, I think, or at least the expression, sugar is more addicting than cocaine. I don't know if that's 100% true, but the concept is definitely true. And we stay away from that.
Interesting. Dr. Kantor, how can people who are watching this blog find more about you and your great work you're doing and about N.A.M.E.D? Where could they go on the web, or phone number?
Well, for the website, just go to N.A.M.E.D Program.com. N.A.M.E.D Program.com. You can get a free week's worth of menus on there. They just ask for your name and email address. I think you'll be able to go onto your website, because we'll have a link to N.A.M.E.D on it. You could go to my personal website, which is Dr. for Dr. Keith Kantor, KeithKantor.com, and look under radio, TV, or print web, and you can see the different articles and shows that I've done, like for Fox and CNN, and local shows too, like Focus Atlanta, and a lot of magazines like elemental, behavioral health. So it's pretty much everywhere, but the only way I really want to do it is through a doctor or a therapist, so it's controlled, but meanwhile you can learn about it.
Great. Well, Dr. Kantor, thank you so much for being with us today. It's great to be in Atlanta and see you again.
Oh, thanks so much for
Look forward to
having me
having
here.
some more time together. Dr. J. Faber signing off.